Hello friends, in this video we will discuss about the neck pain. Okay, so many people experience neck pain or stiffness occasionally. In many cases it is due to the poor postures, and sometimes neck pain is caused by injury due to the due to fall and contact sports or whiplash injury. Okay, so most of the times neck pain is not a serious condition and can be relieved within few days, but in some cases it needs emergency medical attention. Okay, so basically the common condition causes neck pains are degenerative joint disc disease, neck strain, osteoarthritis, cervical spondylosis, spinal stenosis, poor posture, neck injury such as whiplash injury, herniated disc, or radiculopathy because of the pinched nerve. Okay, so patient with neck pain may present with articular, muscular, and neural symptom dysfunction, and the management of neck pain therefore required a thorough history, assessment of joints, muscles, and neural structure. So first we will see how to take history of a patient. Okay, so the locations of the symptoms must be determined because it shows the particular originate area of the pains, basically the upper cervical spine or the lower cervical spine, or it's coming from the right side or left side of the neck, or it is it radiculopathy, means it is peripheralizing, the pain is peripheralizing, or it is in a general localized portion. Okay, so onset of patient symptoms also should be recorded. Okay, so whether it is sudden onset or external, it is due to any external trauma, or any after a prolonged abnormal movement or abnormal posture, or is it due to the insidious onset, or and it should be noted. Okay, so the nature of pain also should be noted, and it indicates the causes like tingling pains. It is because of the nerve root irritations, and the inflammatory pains is basically means oars during the morning times, and mechanical neck pains it oars in the during the time of movement. Okay, so the source of pain also should be recorded. Means if patient pain is aggravating by flexion of the neck, then it may be due to the disc problem, or extension of the neck if causing pains, then it may be due to the fascial joint problem. Lateral flexion, if lateral flexion of neck if causing pain, then it may be due to the foraminal compressions. Okay, so and the position of the position where the pain is reducing also should be noted, and also whether there is any symptoms of vertebral artery insufficiency should be noted. Okay. Now we will discuss about the examination. How to examine a patient. So first the therapist must determine from where the pain is coming. So first we have to observe the patient. Therapist has to observe the patient, and from three different side, like from the back side, and from the front side, and from the sideways also. Any whether the patient is having any abnormality, means postural abnormality, should be documented. Okay, then active movement, the patient is asked to do some active movement like upper cervical flexion and extension, then lower cervical flexion and extension, lateral flexion, rotation, and combined movement pattern. And in during that times, the means whether the pain is getting aggravated or pain is reducing should be documented. Then passive movement test should be done. Means therapist has to passively place the head and neck in different movement pattern like upper cervical flexion and extension, lower cervical flexion and extension. Okay, and any changes in the pain nature should be documented. Okay, then therapist has to palpate the joint area, muscular area. Okay, for any tenderness over the joint or any tenderness over the particular local muscular area, or over the spinous process. Okay, and then it should be documented. Then some special tests should be done by the therapist. Okay, basically first the test is neural tension test and craniovertebral instability test. Okay, then we'll see, discuss about the investigation. Okay, investigation, basically when the examination and physical examinations and the history taking, from history taking and physical examination, the therapist will not be able to conclude any particular diagnosis. Then patient has to, or to know the more severity of the condition, then therapist has to go for the radiological investigation, and the investigations are X-ray, CT scan and MRI of the cervical spine. Okay, okay, then we'll discuss about the treatment part. Okay, the technique selections will depend on the diagnosis and irritability of the condition. Okay, so if one technique is not effective, then the different techniques should be attempted. And multimodal treatment approaches that include the use of exercise therapy appear to be more effective than single treatments alone for the treatment of neck pain. Okay, so educations and exercise have the highest evidence for their role in the management of patient. Okay, and the manual therapy is more effective when it is used in combination with the exercises. Okay, so the first we'll see the what are the means cause of neck pain, like soft tissue causes, we have already seen the muscle strain, muscle knots and trigger points are the common causes of the soft tissue. Okay, so what are the treatment is given for in that area? Okay, basically soft tissue therapy is given. So if the patient will be having any trigger point or muscle knots or any spasm of the muscles, then different techniques are used, like dry needling, ischemic compression, transverse friction massage, and okay, and then one more technique is instrument assisted soft tissue mobilization. Okay, that technique is also used. Then this is the photo which is showing the instrument assisted soft tissue mobilization. The second technique is, then we will discuss about the joint abnormality. If patient will be having any joint abnormality, then how the therapist treats the joint abnormality. First, the technique is mobilization technique. In mobilization, basically 6 different techniques are used. Okay, the techniques are longitudinal movement like traction, manual traction, then posterior to anterior central vertebral pressure, and then posterior to anterior unilateral vertebral pressure, then lateral flexion, then rotations and epiglide from anterior to posterior glide of the vertebra, unilateral vertebral pressure. Okay, then manipulations is also used, traction is also used. Okay, so one by one we'll discuss. In longitudinal traction movement, okay, it is given in oscillatory or sustained longitudinal manner. Okay, it's depend upon the condition. In PA glide of the vertebrae, okay, the pressure is applied through the therapist's thumb in a posterior to anterior direction over the spinous process. Okay, in PA unilateral, means posterior to anterior unilateral vertebral glide, pressure is applied through the therapist's thumb in a posterior anterior direction over the apophyseal joint. Okay, then the third other technique is lateral flexion. In lateral flexion, the oscillating movement is produced by the therapist using a pivoting movement at the pelvis to produce the lateral flexion movement on the neck. Okay, so basically it is done on the towards the non-painful side first. Okay, the head is moved towards the non-painful side. If the lower cervical segments are affected, then therapist has to flex little bit the neck. 30 to 40 degree of flexion is required, then therapist has to perform the lateral flexion. Then same way the rotation technique is also used, where the hand contact is with the cephaloid vertebra of the level to be mobilized, then the other hand grips the chin to assist with the rotation. So same way, the head rotation should be on towards the non-painful side, and if it is if we have to, therapist has to treat the lower cervical vertebra, then little bit flexion, 30 to 40 degree of flexion is required. Okay, then this is the diagram of the therapist giving the central vertebral pressure, means PA glide of the vertebra. Okay, then we'll see one more technique, that is called as neural tissue mobilization. So first, before giving neural tissue mobilization, a therapist has to detect the neural tissue sensitivity, and and after that, once the therapist find any abnormality during the ULTT test, upper limb tension test, then therapist has to give the treatment technique. Basically, slider and tensioner, two type of techniques is given in neural tissue mobilization. Okay, again it is the durations and then duration and dosage of the treatment also depend upon the patient's conditions. Then we'll discuss about the exercise therapy. What are the exercise therapy? Basically, that one is ROM exercises, second is the stretching, and third is the strengthening exercises. Okay, so first stretching, we'll discuss about the stretching. So there are various muscles are there around the neck which are being stressed during the neck pain. Okay, basically the levator scapulae, trapezius, pectoralis major, and suboccipital muscle. So therapist has to teach the patients how to do the stretching techniques independently, and also if possible that therapist has to stretch the muscles in the clinic itself. Okay, and then the therapist has to teach the patient how to perform the range of motion exercise of the cervical spine. Okay, and other technique is endurance and motor control therapy. It is like inner holding of the upper cervical flexion, uh, upper cervical flexion, and which is called as the DNF activation exercise, means deep neck flexor activation exercises. Okay, so in deep neck flexor exercises, okay, what a towel is used behind the head, and the patient is asked to nod if he is saying yes and not losing the contact with the towel. Okay, and the patient is also trained to palpate the superficial neck muscles. Okay, and the movement is being made by the deep cervical uh, flexors. Then one more technique is called as isometric neck exercises. Okay, it should be also taught to the patient how to perform the isometric neck exercise. This photos is demonstrating the stretching technique of the upper trapezius. Okay, then this photo is showing how to perform the deep neck flexor activation exercises. Then this is the photo which is showing how to perform the isometry exercises. Okay, and from different sides of the head. Okay, then postural retraining should be taught to the patient. First evaluate the posture, how the patient posture is, then the correct posture should be taught to the patient, how to correct the posture while performing your daily activity. Then also with that, one conjugant or combination of treatment is given, like tapping technique is also given. Then scapula is basically tapped in a proper anatomical position. Okay, in normal alignment. Okay, to hold the means the normal positions. Then the stress management technique should be taught to the patient, like relaxation techniques, breathing exercises, yoga, and meditations. So above all these treatment techniques, the durations and the intensity and the uh, all the how many times the patient has to perform, this should be depend upon the patient's conditions. Okay, so these are all about this neck pain, and in other videos we will discuss about the particular single topics on the other single topics, like postural syndromes or cervical spondylosis or any PIBD condition of the patient of the neck, okay, or cervical radiculopathy. We will discuss in individually in different video. Thank you.